Hi, my name is Tanya Lozano. I am the founder and CEO of Healthyhood Chicago. Well, even before the pandemic, in Chicago specifically, there is a 20-year life expectancy gap between communities of color and affluent communities. It's actually the largest life expectancy gap in all of the nation. A lot of that has to do with how segregated our city is, so it's very easy to see where disparities are. The pandemic really just magnified what already existed in terms of the disparities here in our city.
It's a new initiative. It's called We Got Us. It's a group that delivers care packages that have groceries, face masks, hand sanitizer, gloves sometimes, soap, other protective items.
So when the pandemic hit, the need of the community was just very clear that it was food. People needed food. So we really just tried to tap into every contact that we had to find resources to get food into our community and then distribute it out. We created a hotline so that our community members could call and request food. And then we created a no-contact delivery service that is still going to this day to get the PPE and the essential groceries out to our people without exposing them to the virus. We also started COVID testing in underserved communities. Over the course of the summer, we've served over 50,000 people and tested over 20,000 people. So now what we're getting ready to do is gear up, and not only will our delivery drivers be able to drop off these essential groceries, but they will be trained in the 5 diseases that cause the life expectancy gap to screen for early detection for those 5 diseases. So now they've built this relationship. They're coming with the goods that the community needs, and they'll be able to early detect for these 5 preventable diseases that cause the life expectancy gap. All of the protests and the unrest, I know that for some maybe it seemed kind of scary, but for those of us that have been in this work for a long time, it was completely inspiring, and it just totally changed what we thought, what the trajectory of the movement for social justice, because we had so many more people who were awakened and ready to participate and contribute. And so I'm hopeful that, we as communities of color who suffer from the broken systems in place will continue to fight to dismantle those systems, but also think about reconstructing and demanding a seat at the table when we're reconstructing what our new normal is going to be.